So often patients will come to us saying, I really don't want to do standard of care. They're pushing me to do, for instance, radiation, and I'm really against it. So I want to unpack that a little bit with the patient because I think folks think as a naturopathic oncologist that I'm 100% against standard of care offerings. There's absolutely a time and a place, as well as a way to make those standard of care interventions work better with less toxicity. So let's use the example of radiation. It's not black and white that, oh, you had let's say you had a local lymph node removed from your breast tissue that was cancerous. You have no other lymph node involvement. You have no other metastatic involvement. This is a classic stage 1 or 2 cancer. Perhaps they noticed a little bit of microinvasion in the surrounding tissue, which is where they'll often warrant a treatment with radiation. This is an opportunity to get clear on whether or not that is a good option for you, the individual. So that's where you want to request what's known as an Oncotype DX or a mammoprint test, which is for people with node negative, single or small tumor positive, estrogen positive breast cancer. That gives you a score that explains that, hey, a therapy like an endocrine therapy or radiation or chemotherapy is going to give you this much better improvement over your overall progression-free survival or your overall survival. So basically, in their world, a score over 20 means that you probably should consider a standard of care approach, an additional approach to just the surgery. There's also a test called a Ki-67 score, which is a cell proliferation score. Similar to what I mentioned with the Oncotype or the mammoprint, this is how fast are your cancer cells proliferating. And things like chemotherapy and radiation and targeted therapies really only like to interface with very rapid turnover cells. So if you have a lower score, then that means that those therapies are likely not necessary and can even flip a switch to taking something that was otherwise slow growing and not very aggressive and making it more aggressive. So we take that information in. We also look at the individual themselves. Are they really sympathetic driven? Are they extremely anxious and fearful about this diagnosis? Because that in and of itself leads to cancer cell proliferation. So if I have someone who's feeling very confident that they're going to do all their due diligence in taking care of their terrain, and they're not coming from a place of fear, and they have a low mammoprint or Oncotype DX or Ki-67 or combination of all those being, let's say, under 20 or 25, then this patient has a good reason to consider not utilizing radiation therapy. But let's say those numbers are high and the patient is really against using radiation therapy. I need to educate them to understand that their risk of having progression or recurrence is much higher with a score like that. And then if we are going to consider radiation, there's ways to prevent the problems that are so scary to that patient. There's ways that we can actually sensitize the cancer cells to the radiation and protect the healthy cells. So we can use sensitizing agents such as very high dose melatonin and having the patient in a carbohydrate restricted state where ketone bodies are really elevated in their bloodstream that actually directs the radiation to the cancer and helps protect the healthy tissue surrounding the cancer. And then we can bring on things like oxygen therapies, ozone, hyperbaric oxygen just before they do the radiation, which also opens up the cancer milieu so that the radiation can enter into the desired target. And then you can also do things like teaching them certain breath. If the radiation is, say, over the left chest wall to protect the heart and lungs, you can actually be taught how to hold your breath during your radiation treatments. There's also ways to utilize hyperbaric therapies to help treat and prevent fibrosis that happens after radiation treatment anywhere in the body. And that's often reimbursed by insurance. So the point is there's no black and white answer to this. You have to look at each individual, their circumstances, their psychology, as much as their biology, to understand how best to support them in making a well-informed choice of whether or not they utilize any given therapy along their cancering journey.